Hello, Brabanters. Joe Worley here, and today I'm going to chat with you about laminitis, what it is, what to look for, and ways to prevent and treat the condition. Let's get started. This is the Brabant Bulletin, brought to you by the European Brabant Registry of America, where people, passion, and preservation are our mission. Laminitis is a common, extremely painful, and frequently reoccurring condition in horses. It has significant welfare implications for owners. This condition affects the tissues of the laminae bonding in the hoof wall to the pedal bone in the hoof. This can result in the pedal bone sinking or rotating within the hoof under the weight of the horse. Or, in extreme cases, it can result in penetration of the sole of the foot by the pedal bone. More than 7% of equine deaths are linked to laminitis, with many animals having to be euthanized. So, you may be asking yourself, what are the causes of equine laminitis? Well, laminitis can arise in three general situations. The first is disease associated with inflammation. For instance, certain types of colic, diarrhea, retained placenta, and severe pneumonia. The precise sequence of events leading to laminitis is still unclear. In diseases associated with inflammation, the exact identity of the laminitis trigger remains elusive. But there is the activation of inflammation throughout the body, which results in turn in lamellar inflammation. The end result is failure of the adhesion between the laminae and laminitis. The second is endocrine disease. For instance, equine Cushing's disease or pituitary pars intermedia dysfunction, also referred to as PPID, and equine metabolic syndrome. The hormone insulin appears to be important in laminitis association with endocrine disorders. But again, the exact sequence of events remains unclear. And there is mechanical overload, such as supporting limb laminitis or SLL. This is often associated with a fracture or infected joint in the other leg, so that the leg which is bearing all of the weight is at risk of laminitis. In mechanical overload laminitis, it is thought that there is an inadequate blood supply to the laminar tissue associated with excessive and continuous weight bearing. So put down that fourth cupcake, David. We're saving lives here. A horse is unlikely to die from laminitis, but an owner may decide to euthanize their animal if the pedal bone penetrates the sole, so that the outlook is very poor if their animal does not respond to appropriate treatment over a prolonged period. Some folks believe that subpar farrier work can also cause laminitis, but there's no documented evidence of this. However, a lack of farriery attention can lead to feet becoming overgrown, which may result in abnormal stress on the feet and hence, laminitis. Often it's the farrier who spots the early signs of laminitis, so be sure to get your horse's hooves trimmed regularly and listen to your farrier. After all, their whole focus is feet. If you don't know what the clinical signs of equine laminitis are, let me take a moment to give you tips on what to look for. Laminitis can affect a single foot, all 4 feet, the 4 feet alone, or less commonly, the hind feet alone. Some horses get very mild laminitis that is not severe enough to cause any visible lameness, but does result in divergent hoof growth rings. The horse often leans back on its heels to take the weight off the painful toe area. The lameness is worse when the horse walks on hard ground or turns too. You can observe the horse shifting weight between feet when resting, and there may be increased digital pulses in the extremities. If you observe lameness, test to see if there is pain by using hoof testers at the point of the frog on the foot. If you suspect your horse has laminitis, call your vet. Bring your horse in from the field slowly and stall rest them. You should make sure there is deep bedding that comes all the way up to their knees and hocks. Be sure to provide plenty of fresh water and feed your horse a diet based on low-quality hay. Kind of like when you run into your old boss at the grocery store and you're like, hey, but you don't really mean it. If necessary, the hay should be soaked to remove as much of the carbohydrate as possible. In order for the vet to diagnose your horse with laminitis, they will assess them for the clinical signs I mentioned before. They will also take x-rays of the pedal bone to see if it has sunk or rotated. They will also likely draw blood to test for underlying endocrine diseases. We have very few tools in our arsenal to manage the disease itself. We treat symptoms, pain, and mechanical instability, but we do not have anything to target the cause just yet.
Says Samantha Brooks, Associated Professor of Equine Physiology at the University of Florida.
Thanks for stopping by, Samantha. Most often, vets will use the obel laminitis grading system. It's useful to describe the severity of lameness. In obel grade 1 laminitis, horses alternatively and incessantly lift their feet. Lameness is not evident at a walk, but is evident at a trot as a short, stilted gait. Horses with obel grade 1 laminitis may exhibit transient periods of weight shifting, have slight increases in temperature at the coronary band, and have slight increases in digital pulse pressures. Horses that walk with a stilted gait but still allow a foot to be lifted are classified as obel grade 2. These horses will often have head-bobbing lameness when walked in a tight circle in either direction. Horses with obel grade 3 laminitis move reluctantly and vigorously resist the lifting of their feet. The most severe classification is obel grade 4, in which horses refuse to move unless forced. Many severely affected horses only rise for short periods of time and demonstrate a characteristic sawhorse stance of rocking or shifting their weight onto their hind feet. The stance is commonly seen in horses with more severe pain in the forefeet than in the hind, and is often accompanied by anxiety, muscle fasciculations, and reluctance to move. Horses with pain equally severe in all 4 feet may have a normal stance. Horses with the most severe cases of laminitis often develop poor body condition and pressure sores resulting from prolonged period of recumbency. If your horse is diagnosed with laminitis, various medicines can be given to control the pain, including non-steroidal anti-inflammatory drugs, or NSAIDs, such as phenylbutazone, bute, or banamine, and opiates like morphine and pethidine. Acepromazine has been traditionally used to increase the blood supply to the feet, as it was thought that all laminitis was a consequence of decreased hoof perfusion. The drug's beneficial effect is probably more related to its sedative properties, resulting in the horse standing still or even lying down, taking the weight off of their feet. In cases of laminitis associated with inflammation, the short term, around 3 days, use of ice to cool the feet may be beneficial. Foot support is a vital part of the treatment to help limit movement to the pedal bone and reduce the pain experienced by the horse. This can be achieved in a variety of ways, including providing deep bedding and frog supports, such as lily pads or TLC frog supports. Stall rest, along with dietary changes, are important factors. Rather than grass, horses should have low-quality hay and no or minimal concentrates. Roughage-rich foodstuffs like beet pulp and chaff can form part of a revised diet. If the laminitis is a result of underlying conditions such as endocrine disorder like PPID, the disease should be treated accordingly with a pharmaceutical intervention such as Presend. Again, the diet of a laminitic horse should consist of low-quality hay feed at 1.5% of the horse's actual body weight. If necessary, the hay should be soaked to remove as much of the carbohydrate as possible. Hay is preferable to haylage, as haylage is more palatable, so the animal will eat more and horses seem to produce more of the hormone insulin in response to haylage compared to hay. If necessary, fiber-based products that contain chaff or sugar beet can be fed instead of some of the hay ration. If extra energy is required once the laminitis has been resolved, then oil can be added to the diet. The European Brabant Registry of America hosted a clinic by Dr. Beth Valentine, which dives into the recommended draft horse diets, so be sure to check out www.europeanbrabant.com. Visit the forum and tune into her very informative presentation. Listen, it takes weeks to months for a horse to recover from laminitis. In one research study, 72% of animals were sound at the trot after 8 weeks, and 60% were back at work. Once an animal has had laminitis, they will be at an increased risk of getting it again. The current episode can be cured, but laminitis will likely occur again at some point in the future. Management changes should be put into place to minimize the risk of a repeat episode. Prevention measures for laminitis associated with inflammation or sepsis can be prevented by prompt treatment of the underlying disease and the use of ice to cool the feet in horses at risk of inflammation-associated laminitis before its occurrence. And that's probably one of the top 3 longest sentences I've had to say. In conclusion, my dear Brabanters, the goal of medical and biomechanical therapies in acute laminitis is to minimize damage to the laminar attachments. Therapeutic measures aimed at the resolution of primary disease process should be instituted immediately. Cryotherapy, if clinically practical, should be applied to the hoof wall and pastern and maintained in a manner that keeps the hoof wall surface temperature at 7 degrees to 10 degrees Celsius for 48 hours. Anti-inflammatory drug therapy is indicated to reduce inflammation associated with acute septic diseases. Analgesic therapy is most often achieved by use of NSAIDs, the non-steroidal anti-inflammatories. However, alternative analgesic therapies may be needed when NSAID therapy is not sufficient or tolerated. Mechanical support should be instituted to limit displacement of the third phalanx and increase patient comfort. There are multiple ways to provide mechanical support, with no single therapy being appropriate for all horses. It is necessary to examine the response of each horse individually and alter the therapy based on pain. Applying support directly to the frog and heel region of the hoof and increasing the contact or weight-bearing surface of the unaffected parts of the foot are among the most effective methods of biomechanical support during the acute stages of laminitis. Horses should be monitored frequently, and the response of all aspects of the treatment regime should be assessed and adjustments made on the basis of that response. If you spot lameness, it may be your run-of-the-mill abscess getting ready to burst. In a worst-case scenario, it may be laminitis. So be sure to be observant. When in doubt, call your vet. Make sure to vet your vet before you use your vet. If your vet's name is Yvette, make sure to vet Yvette to see if she's a good vet. Well, that wraps up our podcast for today. If you have any podcast topic suggestions, we want to know what you'd like to hear. Drop us a line at info@europeanbrabant.com and let us know. Until next time, don't forget that to ride a Brabant is to fly without wings.